Running an endocrinology practice means managing highly complex protocols. You handle hormones, thyroid disorders, and diabetes. But while the clinical side is controlled, the front desk is often quietly falling apart. Calls get dropped, staff get overworked, and resignations pile up. The healthcare industry is currently experiencing a structural breakdown in administrative staffing, specifically hitting front office and medical assistant roles. This chart breaks down the top staffing challenges reported by medical group leaders. You can see that 53% identifies simply finding candidates as their primary hurdle. It completely outpaces retention and compensation. The applicant pool has simply dried up. And while candidate pools shrink, the cost to keep your existing staff climbs. The median base pay for healthcare staff rose 4.3% in 2025. Every year, the floor goes up. For an endocrinology practice running a lean team, standard administrative staffing is an unpredictable expense that eats into your profit margin every single quarter. Look at this equation calculating the true cost of an administrative hire. A medical secretary's base salary might be around $47,000 a year, but when you add payroll taxes, health insurance, paid time off, and recruiting costs, that fully loaded hourly rate jumps to between $28 and $40 in most U.S. markets. Now factor in the healthcare administrative turnover rate, which runs between 20 and 40% annually. You are likely replacing 1 in 3 front desk employees every single year, multiplying those sunk costs and constantly disrupting your workflow. The immediate operational consequence of these staffing gaps and training periods hits your phone system. During peak hours with fewer trained staff at the desk, calls roll directly to voicemail. This donut chart shows how patients actually book their visits. Despite the push for digital scheduling, 71% of medical groups report that the vast majority of their patients still rely on traditional phone calls to book appointments and follow up on lab results. When those calls go to voicemail, consumers do not wait. 1 in 5 patients switched healthcare providers in the past year, and nearly 90% of them left because the organization was simply too hard to do business with. Missed appointments cost the U.S. healthcare system about $150 billion annually. For an endocrinology specialist, every unanswered phone call translates directly into lost patient acquisition and eroding trust. One endocrinology practice in Wellington, Florida, decided to bypass this administrative turnover cycle completely and find a real solution. Instead of relying on generic temp agencies or constant local hiring, they outsourced their workload to specialized, healthcare-trained virtual medical assistants through a company called Staffingly. This comparative bar chart shows the immediate financial impact. The tall bar represents the fully loaded in-house cost of $28 to $40 per hour. The lower bar shows Staffingly's dedicated virtual medical assistants starting at just $8 to $10 per hour. Shifting from a local hiring model, where one sick day can shut down scheduling, to a scalable, distributed virtual model restores operational redundancy and protects your profit margin. These virtual medical assistants are highly credentialed professionals, including medical doctors, doctors of pharmacy, and registered nurses. This interface illustrates their capabilities. They handle complex endocrinology workflows, meaning they verify specialty medications, execute referral coordination, and navigate chronic disease scheduling directly within your specific electronic health record system. And the deployment is aggressive. Practices transition from overwhelmed desks to a fully supported virtual team in exactly 48 to 72 hours. To ensure patient data is locked down, every engagement is protected by an uncompromising security infrastructure. These 3 badges represent full HIPAA compliance, SOC 2 Type 2 certification, and HII Trust certification. Workflow optimization is about deploying trained experts who execute structured processes. According to Phreesia data from 2025, endocrinology practices using structured referral management save 21 minutes of staff time per patient referral. After their rapid 72-hour implementation, the Wellington Endocrinology Practice Administrator saw a complete shift in their daily operational reality. The proof of that success is the public 5-star review they published about their experience. They highlighted 3 specific details: very professional, enhanced office experience, and quick response. Very professional means patients felt they were interacting with someone who deeply understood the clinical context of endocrinology. Enhanced office experience indicates a tangible drop in call hold times, providing relief for the remaining in-house staff who could finally focus on the patients in front of them. Quick response shows that absolute consistency in call handling ensures no patient is left waiting on hold and no patient is forced to call a competitor. Solving the administrative crisis allows a practice to focus its energy back on patient care. Join over 800 trusted providers and start your 30-day free trial today. You can be live in 48 to 72 hours.